Hi scholars, we are now in week 10 and this week's assignment is our practice informative speech. So I will be discussing the history of pap smears. Have you ever wondered what pap smears are and the importance for women to have them done routinely and that they can actually save your life? Pap smears are a test or an exam for women that detect abnormalities, precancer, and cancer. Pap smears were developed back in 1943 by G.N. Papanicolaou. And to give you a little history about pap smears, there was an African American woman by the name of Henrietta Lacks, who her cells were taken without her permission or her consent. These cells, known as HeLa cells, are actively used for research for vaccines and cancer treatments. Although they were taken without her permission, it has brought awareness to patients' rights. Now, pap smears are for women to find out if they have any abnormalities or cancer. They can be accessed at a OBGYN office or even a primary physician's office. A woman will lay in the office on the bed with her legs up in stirrups on each side of the bed. The doctor or the physician will then get a speculum, which is this, to open up the walls of the vagina. The physician will get a spatula or a brush and insert it into the vagina and scrape cells off of the cervix. Now, once they scrape the cells off of the cervix, those are sent to a laboratory for testing, again, of abnormalities, precancer, or cancer. HPV is also very important. HPV is human papillomavirus, and it's a sexually transmitted disease that women can get who are within the first 3 years of being sexually active. Now, this disease can cause cervical cancer. You won't even know you have it because there is no pain involved. Now, or no symptoms. Now, there are vaccines for women to prevent it. The reason why I chose this topic is because I did not take pap smears seriously. As a matter of fact, I hardly even had them done. So back in October of 2018, I was diagnosed with stage 4 cervical cancer. I had cancer in my cervix, my lymph nodes, my pelvis, my ovaries. I had a tumor the size of a baseball in my uterus that metastasized, which means spread, to my stomach lining. I was given 35% chance of living. Had I taken pap smears more seriously or have been educated about pap smears, I could have detected and caught this sooner, and my treatment wouldn't have been so harsh. I went through so much. I went through about 14 rounds of chemotherapy, 38 rounds of radiation. I was hospitalized 3 times needing blood transfusions. I wish I would have known about pap smears and have got them done sooner. Now, men, I understand that you're probably wondering, hey, I'm a man, but it's good to be educated about it and to know what pap smears are, because you have mothers, daughters, significant others, loved ones, to be able to know what pap smears are and the importance to have them done routinely. Thank you. Now, this is me going through my cancer treatment.